Historically, OHSU has largely functioned as a place of hope where patients come from throughout the region and get their care here on the Hill. That model is now changing. When OHSU partners with other communities, what we find is that often we are the recipients of knowledge and innovation that's taking place in communities across the region.
The CURE program is an outreach program for really talented local high school students. Our goal is to train the future generations of scientists so that they can make the breakthroughs of tomorrow.
My parents didn't get to finish college, and so to show my family that this is what we've all worked towards is very amazing.
I can see the different communities represented and really feel that OHSU is doing what we should do.
Being able to see these things in the lab really makes me think I can do it.
KCI van has helped us in reaching out to our migrant workers, to our uninsured families. A lot of these patients have never had an eye exam in their life.
We're pretty much around the full 96,000 square miles of the state. We're using the data we collect on the van as well as the relationships we develop in the community to find solutions. We feel it's time to address avoidable blindness in Oregon.
The mortality rate is significantly higher in a rural area. We think part of it is access to care. People are more likely to go practice in a rural area if they've had a positive educational experience in a rural area.
Starting the Campus for Rural Health has been an important piece of OHSU's commitment to rural training, and that takes the commitment outside of just family medicine physicians and takes it into this realm of being interprofessional. We're bringing students from all of the schools and programs together.
To have that mixture of providers, that team-based care is how we're going to address the primary care crisis in rural Oregon.
I am endlessly hearing from people asking, do you have any graduates who can come and work in our community? I wish that I had a graduate for every community across Oregon.
Zenger Farm is a working urban farm in outer southeast Portland. One of the biggest threats to the health of our country are diseases related to diet. We were selected by OHSU to receive a grant through the Night Cancer Institute, which gives vegetables from a local farm to patients with diet-related chronic disease.
The patients of our Mid-County Clinic are gaining access to fresh, locally grown organic vegetables that many of them just don't have access to. So we're really hoping that this not only improves the individual health of our patients, but that of their whole families.
We are an after-school program where we provide services for kids. We live in a county that is the second worst obesity rate in the state. So physical fitness is a big part of what we do. We've partnered with OHSU to do the research to see how effective it's going to be when we get kids more active.
For programs to be put into place in a community, they have to have continued funding. You have to have data demonstrating that those programs work. Our expertise from OHSU can really help them do that.
There's areas that we really want to improve on, and sometimes maybe we just don't know how.
Our philosophy is to create this two-way street between university and community. Help bring the expertise to the community, but build it there and leave it there.